Hello, welcome to Destination Waiting Room. And today I'm gonna maybe shock you, maybe you hoped to hear that. At certain point, I want to discuss my points of view and also some of my clients about feeling shameful during endless gynecological visits, but also how does the visit itself might trigger shame in many women, actually. First, to begin with, some of women that I've worked with, they have no issue with showing their naked soul to a stranger, but as for a naked body and their genital area, this is something that is triggering for them because either it wasn't the way they were brought up, and just showing the genital area might be triggering. Not to mention that sometimes it's just the first time with a doctor. So it's very, very stressful for a patient that undergoes a cycle of treatment, but also who is changing doctors. And first of all, is just seeing a person who you see first time in your life and who's gonna, snap snap fingers and put a lot of cold metallic tools inside your vagina just to either pinch you for a biopsy or just to scratch something to take a smear, a pap smear. So it's not gonna be pleasant to begin with. I think if it is sometimes just an ultrasound, an image of one's uterus, that's fine to some extent, but also it can be triggering to patients who had cancers before, tumors removed. So before you even enter the practice, you are already triggered because it's not it to some extent it might be unpleasant. Coldness of metallic tools, it's not a really soft and fluffy. Plus, you don't know a person that's gonna examine you, or you don't know a mood of this person, so it might be he or she might be a conversational wise, might be a very pleasant, but also you don't know, maybe not. And a part of this is also you walking there with your feet cold. So there is a huge level of coldness within the examination, around the examination, and it's very mechanical, just to say. So you might have a brilliant doctor who is compassionate being, but sometimes you don't have that. So the level of discomfort to begin with is huge. It is a big deal, and I think that many women are not brought up just to show their vagina to total strangers on and off. And especially like I had it, there might be, if it is a teaching hospital, also students involved. So the level of discomfort, knowing that coldness will be involved, tools will be involved, uncertainty, because if you are going for a specific examination, there is uncertainty of examination itself, plus of the person's moods as well. So it just your anxiety is, well, it plummets actually. So that's how I'm not gonna be Debbie the Downer, but this is how you entered. You just didn't even see the face. This is how you can enter the room with all that, or your pre-assumptions and everything that's showing you that you might think of yourself as a weakling. That's a projection, but you just don't go there from a position of power and control. And well, as there are many videos how to dress up for a OBGYN visit, how fancy your dress or a skirt or whatever there is, it's nice. It gives you I wouldn't say a fake boost. Maybe it boosts your confidence in a very, well, I don't know, shallow or in a minimal way. But whatever feels good for you at the moment, it is. I do that as well. But it's I don't think if dressing nicely will just shoot off all the blackbirds around the visit. So it's not gonna, just one lovely dress will not actually kill all the ghosts that the exact visit triggers. And I wanted to let you know that I understand that sometimes just a nice dress or a nice outlook might empower you while you feel disempowered by the whole visit. And sometimes this empowerment means because you have to go back and redo it again. So with every visit your self-confidence and self-esteem shrinks a little bit, and you might just feel that you're freezing in the moment because there is coldness. It's cold, regardless of how the person you're meeting is really. The external factors of the visit always mean cold. So there is the question, how can I warm it up? How can I find a spark within me just to soften this a little bit? And how can I have, I don't want to say illusion because it's not the word, but how can I feel more in control? Or how can I lose it completely and feel okay with it? Because this visit is actually about having no control over what you might see, over what will be seen on the ultrasound, if it is a longer period of treatment or new discovery, but also there is a portion of it that means really physically pain for you. I mean, biopsy is no near a soft touch. It can be, but it can be really, really a hard experience that you need a painkiller after. So it's a very complex question. How do I get prepared and soften this rather unpleasant and oftentimes painful experience from the physical pain to my emotional pain? And how can I really feel better? So first of all, what you're cooking in it, all the ingredients I just described are a really fine recipe for feeling shame, feeling powerless and cold, and feeling inadequate too. All your insecurities will just, appear on surface magically. And shame is I am this and that, and I don't feel safe. And how can I feel safe when I know that I can hear bad things, or it can be painful for me, or I'm gonna cry? Because I mean, I've cried so many times during the visits, and there is time limit to it, so you can't really cry for an hour. So all your feelings and emotions that will be listened to, but also within a reasonable slot of time. With all that, feeling shame, and there is something that people are unaware. They wanna that there is a shameful posture. So the walk of shame, how sometimes I call it, when you have to go and climb the fantastic chair, it for some is a walk of shame, because you have the same posture, not like Quasimodo, but yeah, you bend, you are not prideful, especially if it is repeated action. So you feel shame, you feel insecure, but you also show shame in your walk, and the way you walk towards that chair, and going from the chair to the clock room, the behind the curtain place, shows a lot of. And actually, if you look from the time, how this the whole appointment is structured, so you go for a 5 minutes talk, or however, so you go for a talk, you change, you go to a chair, you come back from the chair, and then you have another talk. So basically, the most disempowering moments are on the chair, but going towards and coming back from the chair, meaning that how you walk and how you secure yourself to warm up on the chair matter the most, because after that, the conversation you might have, you need to feel as in your body as possible. So the shameful walk can be a prideful walk. You just need to see whether you're bent or not, and how to really go slowly, and how to really, I remember that for me, which might be a very weird discovery, or very minor for you, was that for me the most important thing on the chair, and believe me, I said that for I don't know how many, I think 100 times easily in the past 2 years, 3 maybe, it's just that my feet, they were so cold. So for me, it wasn't about the skirt, a blouse, a dress. It was all about my feet being covered. So when I felt warmth in my feet, and when I look at my feet and I like the socks I was wearing, that was the moment that I can breathe deeper, and that I wasn't frozen. I was the moment of warmth, and that I took care of myself was really liberating for me, despite the whole mockery and fuckery of the visit. It was just so liberating that I can do this tiny thing that matters. And another one was walking from towards, I just, it wasn't that difficult for me, but coming back from the chair when you heard news or when there was another biopsy or on I call it a pinch. It was difficult. I needed to focus myself that, okay, I'm not gonna bend, I'm not gonna be a Quasimodo. I can have a prideful posture in it, and I can walk pridefully despite being defeated in a way by the news. So that's something about the posture, about the feet, and also about the gaze, because that might be an issue, that you look away from the news, look away from the doctor, look away. So if it is possible to look them in the eyes on the ultrasound machine, that would be perfect. And also in that chair, for me, and I will put a good link for a meditation before going into that room, was compassionate listening to the doctor, what he's saying, she's saying, but also that despite the coldness of the experience and maybe of the room you're in, I still find that compassionate listening and using a compassionate imaginary that helps. So just to make yourself a little bit familiar with the room you're in, that can actually melt one block of anxiety and insecurity away. And with that melted block, you might feel a bit better and a bit more at ease, which I hope you will. Thank you for listening, and please remember to subscribe.